Which type of agnosia is due to parietal lobe damage? Options are gustatory agnosia, auditory agnosia, olfactory agnosia, and somatosensory agnosia. Answer of this question is somatosensory agnosia because rest of the agnosia are because of temporal lobe damage, and this somatosensory agnosia is because of parietal lobe damage. This topic about the type of agnosias. There is what is agnosia? Agnosia means inability to interpret sensations and inability to recognize things, typically as a result of brain damage. Common causes of agnosias are head injury, stroke, brain tumors, brain abscess, and disorder that causes progressive degeneration of certain area of the brain, such as Alzheimer disease. Agnosia are divided into five types according to persons. Like first is auditory agnosias, that is related to hearing sense. People cannot identify objects based on sound. For example, they cannot identify a doorbell when they hear it rings. This type of agnosia results from damage of the temporal lobe. Gustatory agnosia. People cannot identify tastes even though they can experience them, like spicy taste. This type results from damage to the temporal lobe. Olfactory agnosia. An inability to recognize an odor sense even though olfactory processing, language, general intellectual functions are essentially intact. Olfactory agnosia may result from damage to the front part of the temporal lobe. Somatosensory agnosia. For example, people have difficulty identifying a familiar object such as coffee cup, belt that is placed in their hand. However, when they look at the object, they immediately recognize and can identify it. This type of agnosia results from the damage to the parietal lobe. Visual agnosia cannot recognize common objects such as tomato, carrot, even though they can see these things, but they recognize them when they touch at the objects. Visual agnosia results from the damage to the occipital lobe. Now, some difficult terminology. Anosmia means absence of smell function, loss of qualitative olfactory sensations. Partial anosmia means inability to perceive some but not all odors. Hyposmia or macrosmia means decreased sensitivity to the odor. Hy- Hyperosmia means increased sensitivity to common odors. Dysosmia, parosmia, and cacosmia are distorted or perverted smell perception due to odor stimulation. Phantosmia or olfactory hallucination is a dysosmic sensation perceived in the absence of odor stimulus. Heterosmia means all smell are same. Presbyosmia means decline in the smell sense with the aging. Osmophobia, fear of certain smell. Prosopagnosia, people cannot recognize familiar faces. Environmental agnosia, people cannot recognize familiar places. Achromatopsia, people becomes colorblind. Anosognosia means people insist that nothing is wrong or ignore the problem, even though their one side of the body is paralyzed. Simultaneous agnosia. People cannot see more than one object or part of an object at a time. If they look at the table with food, various utensils on it, they may say they see only a spoon. That is called simultaneous agnosia.